Joining me now is Dr. Paul Sachs, an epidemiologist from Brigham and Women's Hospital in Boston. Dr. Sachs, thanks for being with us.
Thanks for inviting me.
Well, now that things are starting to open back up, we wanted to go to you, get your expert opinion on the way people will take part in some of these everyday activities in the next few months. Of course, summer vacation is top of mind for a lot of people right now. And for you, when would you feel comfortable taking a vacation that's, say, within driving distance, where you would stay at a hotel or an Airbnb or a summer rental?
Well, I think it kind of depends on where these vacations are taken to. Right now, fortunately, in the United States, most of the United States is experiencing a decrease in cases, but there are some regions that still have an increase. I would try to avoid traveling to one of those places. But the kind of vacation that you described, getting in the car, driving to a B&B or driving to a hotel, those should be relatively safe, and with the, of course, caveat that nothing in this era is 100% safe, but those should be relatively safe right now because you're not really subjecting yourself to the most dangerous situations, which are crowds.
Sure. So if you were driving to Cape Cod, for instance, to a rental cottage, and you took the normal precautions that you would at home, you think you'd be fine?
Yes, I do.
Okay, great. How about, so many people have been going over with a neighbor and social distancing, maybe in the yard, or you see people sitting on beach chairs out on their street. How about attending a small dinner party inside someone's house?
So that's a tricky one because outdoor activities are clearly much safer than indoor activities. And what we've known from these terrible super spreader events is that all it takes is one person who has the infection to spread it to multiple others if that person is in that contagious phase, which is the first few days right before and after they get COVID-19. So indoor activities right now are tricky with a group of other people. If it's a very small group, it's better. If it's just one other couple or two other couples, especially if they also have been healthy and practicing social distancing. But I would avoid indoor dinner parties for now.
How about sending kids to camp? Children don't seem to get the virus, of course, as much as adults do, but still, they're going to be with other adults, big crowds. What do you say about that?
So I have mixed feelings about the situation with children, and I just want to say that I'm married to a pediatrician, and she has feelings about this too. We both know that children do not seem to get this virus as seriously as older adults do, and that's the good news. What's a little less clear from the data is whether they can catch it and then spread it to older individuals, and that would be a potential concern. On the other hand, it's so important for children to have these activities that we don't want to keep them sequestered at home while the weather's good and they want to play with their friends. So I have a lot of mixed feelings about it. I think overall it makes sense at this point, with the number of new cases down, to go ahead with camps and schools.
Do you think that the precautions that have been given to daycare centers will be effective?
I think they're necessary. I hope they're effective. Obviously, we know that kids don't always have the best sanitation. On the other hand, they are, as you mentioned, mostly protected from getting severe COVID. There are a few isolated cases of this severe inflammatory syndrome, but mostly they get either asymptomatic infection or no serious illness at all.
We're lucky we are in the summer months now. If you were going to send kids on a play date, would you just tell them they have to stay outside the whole time?
That would make a lot of sense to stick to outdoor activities as best you can. I do want to say that, people are going to say, well, what about using the bathroom? Well, if you're going to be inside for very short periods of time, that's also quite safe. It's really the prolonged time indoors that we have seen in things like concerts and restaurants and bars that have been dangerous.
Sure. So many people have successfully worked from home, but a lot of people don't like it very much, and they want to get back to their office, even with the lower numbers. How about work in a shared office? Should you wear a mask the whole time, or are you okay as long as you're 6 feet away from other people at work?
In general, I think masks in public are going to be kind of the way we go forward for quite some time. And that would include masks within a shared office. I do understand that it's difficult, but right now that would be our recommendation. There are some people who are substituting face shields for masks in that context, and that's because face shields are very effective in preventing the spread of virus to others and also protect yourself somewhat. And they're a bit more comfortable for certain individuals. Plus, you can sip your coffee and you could eat, etc. And so I think there's some infectious disease specialists really support the use of face shields as a substitute for masks sometimes.
Huh. And if you're going to go on a hike or a picnic outdoors with friends, if you're in the great outdoors,
I think that's one of the best ways of expanding your social circle is to go on a hike, is to meet your friends for a picnic, because the virus gets dispersed so readily in outdoor settings that it's really very, very difficult to imagine a situation where it would get transmitted. So I'm a strong advocate for those activities. I'm also a huge advocate for sports like tennis and golf if you play those.
That's good. And, those are sports where you can socially distance.
Yes, absolutely.
One of our most heartbreaking sights, of course, has been what's gone on in nursing homes. And relatives have been so lonely and want to go visit their relative or mom or dad in a nursing home. What is your advice to them about what the home should be doing when they arrive?
So I think that as you alluded to, the most vulnerable populations are the people in elderly homes, and we really have to protect them. I'm hopeful that we'll be getting to a situation relatively soon where we have the kind of point of care testing that is technically feasible so that people visiting individuals in these homes can be tested right before they go and visit. And once we get to that, it'll open up all kinds of freedoms that we haven't really had for this epidemic at all, including visiting elderly loved ones in nursing homes.
When would you feel comfortable going to eat at a restaurant? First of all, let's talk about this outside situation right now, but then when you would go inside.
So outside is obviously better for the reasons I've alluded to. And I want to say that I'm speaking on behalf of myself and really my wife. Both of us have been working through this, and we understand that there are people who have not been working at all, and so they may be more cautious. But I would be comfortable going to a restaurant now and sitting outside. And as for sitting inside in a restaurant, I'd like to see a few more weeks at least of continued downtrending numbers before making that commitment.
Now, a lot of people really miss going to the gym. The gym is obviously where you're touching a lot of weights and equipment that other people are touching. When would you go back to exercise at the gym?
So the gym is riskier more for the crowds than it is for the surfaces. I think the surfaces, as we've learned, while theoretically a place where you can catch the virus, they're not likely to be a common cause of catching the virus, and is provided that one uses the hand sanitizers and other and wipes, and the gym is not crowded. I would not think that the gym would be a highly risky place. However, a very crowded gym where you're packed together and exercising right next to someone who's breathing heavily during their 45-minute workout and your 45-minute workout could be a risky situation, but not from the surfaces themselves.
That's good. A lot of gyms are setting up their weights and some equipment out in the parking lot and distancing people, so maybe that would be a better option.
That's a very good approach.
What about airplanes?
So one thing that most people don't believe when I tell them this is that the air in airplanes is actually not recirculated indefinitely. It's actually have a lot of air exchange. And so the primary risk of flying in airplanes is that you're going to be seated right near somebody who has the infection. It's not that the air itself inside the airplane is dangerous. In fact, the air is probably ventilated more in an airplane than it is in many workplaces. So the airplanes themselves do not concern me, provided that the jets are not packed full. I know that there's going to be a try to make a commitment so that the airplanes are not full, and most people who have flown say that they're very far from full. So the airplanes themselves do not intrinsically concern me. What concerns me is perhaps getting in a crowded situation, boarding, or being in a place where you can't avoid the public transportation system and that's crowded. But flying itself probably is likely to be safe. I would like people on the planes to be wearing masks. I think that's a good idea.
Good idea to wear a mask while you fly.
Yes.
And, there are so many families that had to delay the wedding that they had invited, 200 friends and relatives to this spring, and now they've delayed it till, October, say. When do you think it'll be safe to go to a big wedding again?
It's a really excellent question, and one for which I can't unfortunately give an accurate answer or a good prediction. It really does depend on what the case trajectory is like over the next several months. I have friends and family who have had to delay their weddings. I think it's best to delay until we can be sure to have a safe celebration.
So you think people that even put off their wedding till September, October, maybe November, that those will probably be delayed once again as well?
Yeah, I think it's too hard for me to make a prediction, so I'm going to say I just don't know.
Yeah. How about going out with someone who you don't know well?
Right. As we kind of get out into society more, and people who are single and want to date, it is understandable that they'd want to get together with individuals. I think as long as the groups are very small, that it's relatively low risk right now because the number of new cases has declined. I wouldn't recommend at this point gathering with a large group of people who you're not friends with. You want to expand your social circle with relatively small increments, not increase all at once.
Sure. Can people stop wearing face coverings outside? Let's say if you're sitting at the beach?
So from my perspective as a sort of infectious disease, my perspective as an infectious disease specialist is that wearing masks outside really is probably not necessary unless you're very close to someone else. And that's kind of contrary to what you kind of are hearing. And part of the reason is that we want people to wear masks outside, if only to send the signal that we support the use of masks as an infection control strategy for indoor use. That's where it really matters. So I say to people, you don't need to yell at the jogger going by, at the bike rider going by if he or she's not wearing a mask. And the same is true if you're sitting on the beach with your family, you don't need to wear a mask either. It's really more for, if you're going up to the snack bar and you're going to be close together with another person.
Right. As soon as you can't keep yourself 6 feet away from another person, yes. Right?
Correct.
So, people have been under the stay-at-home advisories in all these states, and now it's summer, and they're going to start having situations, as we've discussed, pop up. And most adults are going to stop for a minute and pause and think. What's the one question you want people to ask themselves when they're making these decisions in the days and weeks ahead?
Well, one important question is, how at risk am I of getting COVID-19 that would severely harm my health? And I would say in particular, it's the older individuals with comorbid medical conditions. I know that the younger people can get very sick from this also, but the people who are really suffering and are by and large older people with underlying medical problems, and they're the ones we really need to protect. So before entering into a situation that's potentially risky, if you fall into that group, really think twice about whether you need to be in that situation. And I'm really not talking about going to the grocery store, because I don't think that's a very risky activity. I'm not talking about taking a walk outside. I'm talking about, deciding, for example, that yes, I'm going to be one of the first people to eat indoors at a restaurant. Maybe you should put that off if you're falling in one of those groups.
All right. Dr. Sachs, we appreciate all of your thoughts. Thanks for being with us.
Thanks for inviting me.